Welcome to Design for Digital Health. My name is Ben Blumenfeld. I am the partner at Designer Fund. Our goal for tonight is to give you guys a sense of how design can impact the healthcare space and also give you an opportunity to connect with all the designers, investors, founders, and domain experts who've come here tonight. All of you care about building better design products and services for digital health. So we want to make sure you have time to meet and leave here with at least 2 or 3 connections with other people. So make sure you do that. For those of you who don't know, Designer Fund is an early stage venture firm. We focus on helping startups scale their design teams and build better design products and services. We're really excited about bringing better user experiences to spaces like financial services, business tools, and of course, healthcare, which is why we're here. A few of the companies on our panel are actually Designer Fund portfolio companies, so Better, Commure, and Omada, oh yeah, he's on the end, our wonderful hosts, and you'll be hearing more from them tonight. The way we're gonna run tonight, we're gonna have a brief 15, 20-minute discussion on design and digital health and some of the things that designers should keep in mind. And then every single panelist here has prepared a case study, and they're gonna dive in and show you basically how design has worked or has not worked and some of the products and services that they've built so that we can all learn best practices from one another. And then at the end, we'll all have a chance to hang out and meet more people. So that's how it's gonna run. Sounds good? Outstanding. All right, let's start with meeting these fine panelists. So introduce yourself, give us your name, your company, and what your company does in 1 to 2 sentences. All right, Deirdre, we'll start with you.
Hey guys, good evening. So my name is Dieter van Lamoen. It's Dutch, difficult, like healthcare. So Commure is an effort to bring a radical increase in innovation in healthcare to doctors and hospitals. One sentence.
Yeah, that's great. Yeah. You'll have plenty of time to expand on that. All right, keep it going.
Hi, everyone. My name is Rachel, and I'm the founder and CEO of Better. And what we do is we get people money back from their health insurance for out-of-network claims. So you see that therapist that doesn't take insurance, we help you get your money back for that.
Good evening. I'm Kwame. I work at Clover Health. I manage the design team there. Clover Health is a Medicare Advantage insurance company combined with a tech company. So we're trying to take advantage of the data stream that an insurance company gets to create better healthcare or better health outcomes at lower cost.
Hi everyone, I'm Susan Dibbs. I'm the VP of Product and Design at Collective Health, and we are on a mission to make it easier for people to find, navigate, and pay for care by providing health benefits and insurance for companies and their employees.
And hi, my name is Patrick Weiss. I'm the Director of Product Design here at Omada, so welcome. Omada helps people who are at risk for getting type 2 diabetes develop better habits, healthier habits, so that they can lose weight and decrease their risk. And we do that through a year-plus-long program with coaching that's delivered through an app and a website.
Outstanding. And if you guys see Patrick, he's got some sweet new crutches.
I'm a living model of healthcare's need for design.
I love it. So let's start, Patrick, while you already have the microphone, so we'll just have you kick it off. So the first discussion we want to have is, what are the biggest opportunities for design in digital health? So let's have you start. You spoke when we spoke on the phone earlier this week. We talked about data and having the ability of using data to make something people can actually use for healthcare outcomes. That's one path.
Yeah, I'll kind of elaborate on that. So, I mean, part of what we see every day are folks who are struggling with their health, and there's a few acute problems they're having. One is that getting healthier is complicated, especially if you've already gone down this road of being at risk for diabetes. 2, a lot of them lack the education for what they should know to actually turn that around. And 3 is kind of the direct tools and techniques that they can plug into their life that feel tangible and approachable. And so I think it's probably a theme across a lot of us is like helping translate a lot of that complexity, helping educate folks on different techniques, whether that's translating the complexities of insurance or for us trying to teach them the basics of nutrition and activity so that they can feel confident to take the first step and actually try something. So we spend a lot of time trying to hyper-personalize using data to figure out what is this individual's unique needs, because no two people are the same when it comes to health, and what is the one or two techniques or habits we could help them build that could help them start this momentum about getting healthier. And so yeah, it's pretty much the nature of our program, just finding things that work for each individual and continuing to optimize and build on that.
Outstanding. Anyone else want to go next? Opportunities for design to affect digital health?
Yeah, I think one, data and design, I think the two Ds is awesome together. There's this beautiful marriage between like data scientists and designers nerding out, which I just love. An example of that is thinking about, okay, well, how do we proactively help people when they're going through a care need, right? Like a lot of times, I also had surgery on my knee, and I actually didn't know where to go. I work in the healthcare industry. Like you would assume I know where to go. And I was stuck because I didn't know where to get surgery. And so we have all these indicators with our data scientist team just to like mine what are people doing, what do we know about them, what are they searching for on our site, to actually proactively message them. And then as designers, I think, oftentimes we're like, oh, message, that's an email. Okay, well, this is healthcare. And if you're talking about, let's say, cancer, maybe an email isn't appropriate, right? And I think us as designers have a really great way of thinking about the people behind the message and sort of saying like, okay, well, what would that be like to get an email about like, hey, we noticed you might have cancer. Did you know you can get a wig for free? Okay, well, that's a pretty shit experience, right? Even though the outcome might be great, like, wow, you can get resources. And I think just we as designers have a great way of thinking about like, what is that optimal experience gonna be like? And the second thing that I'm also really excited about right now, which is kind of a little bit more gnarly, is looking at kind of the underbelly of the health insurance industry. It is such an antiquated experience, one that is, other health insurance companies or the young ones are 20 years old. And so we as designers can start thinking about different processes like out-of-network claims. Like, I don't know about you guys, but if I had to submit one of those, I had to fill out a big form. I didn't understand any of it. I mailed it into an abyss. Right? And like maybe I got a check back and then I called, and they didn't know where it was. So there's a lot of ways that we can redesign the experience by focusing on the people and focusing on the ideal journey.
Excellent. Yeah, Rachel, you want to piggyback off that?
That's a really good follow-on. So instead of filling out all of those forms and mailing something into the BIS, you can download Better and snap a photo and be completely done with that experience. And I think you're totally right. We spend 33 cents of every healthcare dollar on healthcare administration. But what ends up happening for people, right, when you're a patient, when you're dealing with a serious illness, a chronic illness, it becomes a full-time job. You're carrying around your stack of papers that you've gotten from various doctors, your test results. You have to hand that to every new doctor that you see. It's very, very difficult to find the right doctors. Often you're visiting, multiple before you find one that's a fit. So I think anything that improves the patient experience and makes it easier for people to access healthcare when they need it and takes away the burden of that full-time job is a really important design problem to solve.
Amazing.
I think a lot of people up here are touching on, there are some surveys that have been done, and different people have done them and come up with different numbers, but roughly 80% of adults in America do not have adequate understanding or what we call health literacy. So if you are trying to navigate the insurance system, or you go to the doctor and your doctor tells you you need this medication for these reasons, they use a bunch of health jargon, and even if they don't, you have a pretty good chance of not understanding what they're saying. There's a huge gap between most of us and those who went to medical school or nursing school. So I think designers can do a lot to try to bridge that gap. And something that everyone's been talking about, well, not everyone, but a lot of us have been talking about data. At Clover, we understand that a data scientist can come up with a really good insight. But what we really need on the other side of that is somebody in operations who can go and make that actionable and turn that into something. So if we discover, we stack rank hospital risk for all of our members. And then we try to go and visit or call the people who are most at risk and try to figure out what we can do to keep them out of the hospital. And using that to try to lower health costs in the system. That's a huge opportunity, is like understanding the data stream and then figuring out who the right person is to make that something actionable.
Great. So I think to sort of characterize a lot of what you're hearing is about empathy. And I think if you sort of distill design, a lot of it is about being able to sort of put yourself in other people's shoes. You know, very compelling consumer experiences, be it insurance or getting care. We focus on the other side of this equation, which is the doctors themselves, which, you know, if you spend 14 years of your life studying to become a doctor, you generally do that because you have some desire to take care of people. I think if you look at what's happened, particularly in the US with doctors, is, you know, if you put yourself in the shoes of a doctor for a moment, you spend up to 70% of your day essentially being a data clerk, entering sort of data into what amounts to an accounting system. So if you think about sort of empathy as a concept that we want for doctors, this is something that is essentially eroding. With every hour you put on a computer, you're not spending time putting that energy into your relationships with patients. So when you hear Silicon Valley talking about replacing doctors with AI, I think we fundamentally miss that this is one of the most profound human-to-human experiences, right? In your deepest, darkest moments, the person that you want is a doctor that's going to tell you, here's what you're facing in the next steps, not an AI that sort of, you know, whoever prompted the fact you have cancer, right? Well, that's true, but this is what that means. You know, we work with Boston Children's as one of the hospitals, and they often use the example that, you know, parents that receive a Down syndrome child, their first question is, doctor, what does this mean? And in that moment, you have a choice as a doctor. Do you talk about, well, what this means is you have a beautiful child and that you will go on a journey with, and this will be one of the most life-enriching experiences that you'll have? Or do you talk about chromosomes and sort of the experience that you have there? So this is a long way of saying that the opportunity in design, I actually think that healthcare as such is the largest opportunity in 2018 for designers, period. If you think about sort of 20% of GDP being spent on healthcare, what we're summing up is essentially a set of challenges that persist all the way from the consumer experience to the back-end offices of insurance companies. In each one of these interactions, design has a key role to play to massively improve the system. And the single best way to describe what needs to happen is a massive injection of empathy.
Thanks, Didi, for that. Yeah, you can clap for that. Before we get to the case studies, the other thing, you know, most of the audience here are designers. A number of you said you're not currently in healthcare, but are actually considering healthcare or want to come back to healthcare. So one of the things I wanted to cover was, what should designers be keeping in mind when considering entering healthcare as a space to work on? Or even the designers who are in healthcare who are like, what's going on here? You know, what are the knowledge, what's the skill sets that they should keep in mind when working on it?
I mean, I think this is what we're touching on over and over again, right? It's all about empathy. You're interfacing with people, you know, maybe in their darkest moments, right? We have users write into Better, and Better is a lot like Expensify for health claims. However, people tell us their narratives. They say, I can't file these claims on my own because I'm too depressed to get out of bed. Or let me tell you about these claims for my daughter. She had a traumatic brain injury. So, you know, when people are sharing these types of stories with you, you have to think about them every step of designing your product and how to empathize with their experience and what it is that they need to get out of it.
Can you give that, you talked about an example with profile photos. Can you just quickly?
Yeah, so when we were working with the designer on a redesign of our app, one of the things that we debated a lot is, should we have people, you know, add profile photos? People are sort of curating their health information, they're adding insurance cards, they're adding family members. You know, it makes it feel like their space if their photo is there. However, on the flip side of that, you know, having people, you know, request a photo, when they're really, really sick, maybe they're facing cancer, maybe they're really depressed and they feel like crap, they don't want to put a photo in at that time. So what we've decided at this point is we haven't implemented the feature, and in the future, it'll be something optional that our users can do if they want to curate the space that way.
Awesome. Anyone else want to build on and follow up things that designers should keep in mind when considering healthcare as a space?
Not really a follow-up, but when we talked about...
Bill, continue, different point.
It's really easy to think about point solutions in healthcare, but the system is so complex that it really... One of the case studies that Ben asked us to put together was a failure case. And I'll get to this later maybe, but we might not have time. For us, one of our failures was because we didn't take enough time to really understand the entire context. So we thought about a problem, dug into it, and delivered on that solution or for that specific problem. But the problem was much bigger than we understood. And what Clover was good about in the early days was bringing in people who did not have healthcare experience, which is great. We need that. We need to infuse some new energy. But people who know healthcare can bring a lot to the table, and we didn't really have enough of them around to fully understand what we were doing in this particular problem. So it really takes a lot of effort to really study, learn, work with clinicians, work with people who are on the administration side, whoever those experts are that know what your company is trying to dig into. Absorb everything you can from them and understand the entire ecosystem from that perspective, and that helps create much more informed solutions.
Kwame, one more thing before you pass the mic. You talked about like designer as facilitator, which I thought facilitation is a skill. We actually at Designer Fund, we talk about, what are all the other skills that designers need to be great leaders? And then when you told me about like the example at your company where a designer there as a facilitator, who I want you to just quickly touch on that example, I thought, man, maybe in healthcare, facilitation is almost essential, not a nice to have. So can you talk about that one example?
Yeah, I think I can echo that. That it really is a strong point that our team delivers a lot of value through facilitation. So bringing together diverse groups of people is how you get really good solutions. The specific example I was talking about was someone who came to us from General Assembly, former journalist, and was really good at listening to people and crafting that story and building a narrative. And then what she's learned by going to General Assembly and becoming a designer is how to represent that visually. Through listening to clinicians, to engineers, to product managers, to whoever is in the room, she can then put together some sort of artifact, which is often a diagram, but sometimes a UI, and just show people, like, here's what you're talking about. Here's what I heard from each of you. Here's how this all blends into one perspective. And then when they see that, they're all on the same table, and then they can react appropriately and decide, oh, no, that's not what I meant. I was talking about this other thing. Or, yes, that's exactly what I meant. And then the engineers can say, oh, well, that will take us this long to build. It makes things go a lot more smoothly.
Yeah, I love that. The ability to make something real and tangible that people can react to.
So thinking holistically and visually is something that we are really good at bringing to the table.
Great.
Yeah, I have two things, actually. One is, especially in the healthcare space, is to understand who's going to pay for your solution. I think there's so many, like, we've all had shitty healthcare experiences, right? Like, I was just talking about Nisa. I mean, he's got one right now.
Maybe his is a good healthcare.
Yeah, maybe he's got, I don't know. No, it doesn't look swollen. It looks pretty good. But, and I've worked with a bunch of startups at Rock Health, and there's all these really cool ideas, and you start thinking, like, well, who's going to pay for this? And then you start going, like, well, what ICD-10 code is that? That's really sexy. No, it's not, but it actually is a business. And so you have to start thinking about, well, how do I actually, how do we actually help that person that potentially has cancer, right? How are we actually going to fund that? How do we scale the business if there's a bunch of social workers on the phone? And so you can come up with all these really cool solutions, but it's actually not going to help anyone if it's actually not a business. So, we work a lot with our BD guys, like, okay, can you do the business model for this? Okay, how about this type of solution? And I think that's important for all designers, but I think especially in healthcare, because there's so much opportunity and there's so much kind of waste. You start looking at the rising costs of 5% increase year over year. It's kind of outstanding in a negative sense. And the second is really thinking about context that you're designing for. We're in Silicon Valley. There's so many shiny, cool tech. I've got an iWatch, an Apple Watch. But, we start looking at, who we're designing for. Okay, well, someone that has a flip phone that speaks Spanish. That's one of our members. Okay, well, how is our app going to help her? It's not. But how can we give her the same experience that, the other tech worker that has an iPhone, the newest iPhone, and the Apple Watch has? And so it's just something to think about, to design, both in print as well as design, really cool, flashy on, different devices.
Patrick?
Yeah, actually, a lot of the points that I was going to highlight, Kwame and Susan were mentioning, but I think when I'm chatting with designers who are looking to get into health, there's like three main pieces. One is the empathy piece that we keep hitting on, which is, especially at least for us at Omada, our users are very different than us. They're often in the Midwest and the South, and they have totally different worldviews. They're less tech savvy, and it's really important to be able to design from a place that is not your own opinion, because our users are not us. And so we spend tons of time in ethnographic research. People are crying. This is a really sensitive topic to a lot of people. I think between health and finance, these are like the two most sensitive topics you can design for. And so that's just something to adjust to. It's real personal issues that people are struggling with. The second piece that Kwame was hitting on was just the complexity. I think, coming from design for not health before I was here, as designers, you get very good at kind of working at the intersection of user insight, your own intuition, technical requirements, and business requirements. I think when you get into a space like this, you start to layer on a few more things, like regulatory requirements or clinical needs. So we have a clinical team of doctors that basically inform all of our design concepts from the beginning, so we're not designing something that's unsafe out the get-go. But that's a different skill and input you have to factor in. And then data is the other thing that's been coming out a lot too, is like these people are so variable of users, we need to be able to use data as a tool to design from. So just being able to process all those different inputs is a really powerful and important thing. And then I think the third piece is turning that into something tangible, because it is so complicated. As designers, you have the unique ability to take all of these complex pieces and put it together into something that is tangible and share that with a broad, multidisciplinary set of people and get alignment, which is a really powerful skill that not everyone has.
Awesome. Thanks for sharing. Did you want to add anything? After this, we'll transition to the case studies.
Great. So just to invoke quickly the regulation arguments, it's one of the most often invoked reasons why it's hard to work in healthcare. I think it's crap. If you go read HIPAA, it's 7 pages. It's actually not that hard, but it's something you need to take serious. And I think we as folks working on healthcare, we should be setting an example of how you can embrace regulation sort of from a first principles basis in product. I think the other big part is, we're trying to create something where literally we'll have tens of thousands of people sort of unbundling workflows in hospitals and create great experiences. I think when you approach problems like that, the thing to keep in mind is this is not rocket science. We're not trying to land rockets on barges. We're literally taking basic concepts that have been proven elsewhere and bring it to healthcare. A couple good examples. If you take search, right? We're all used to Google working or Facebook. You plug in a name, data pops up, and it's the relevant data. Healthcare, if you're the average doctor, you pop open your landing page for your patient. There's 3 search boxes, not distinguished. You put the patient name in, and it turns out that none of the search boxes actually give you the basic demographic data for the patient. Now, this is something that, we look at and go like, well, but who designed this? Like, why does it work that way? You provide just universal search for these folks, and it's magic for them, right? It is something we take for granted. Other good example is ordering sets. If you bump into a doctor in a hospital, the first thing they'll do is they'll order stuff. So they'll order procedures, they'll order drugs, and there's not one set of orders, that's just the doctor's orders that attended to you. Then there's the pharmacist's orders, the care team orders, the nurse's orders, they're all nested. Now let's say you're the doctor and you decide that, whoops, I didn't really mean to order the insulin treatment. You undo your order. You'd think that that undoes all the other orders. It actually doesn't. So somebody that's been in the hospital for 4 or 5 days, you open their chart, and at the bottom you have a bunch of orphaned orders for medicines, procedures. Now the night nurse calls the attending doctor, hey, this thing at the bottom that I'm not really sure what I'm supposed to be sort of administering a particular drug or treatment, this is sort of the state of medicine. Literally, a doctor told me the sort of degree to which orders are cleaned up is basically a function of how bored the night nurse is. I mean, this is sort of state of healthcare 2018, right? This is not sort of, hey, we need to fix AI for doctors. It is, we need to provide sane pick lists and workflows that sort of exist in every other industry. And if you approach this space, it's really don't look for the shiny objects. Look for the stupid, dumb stuff that nobody has fixed. And start with that, right? And then figure out how to get paid for it.
Outstanding. All right, so we're going to transition the room real quickly. We're going to move the panelists aside. We're going to drop the screen. And Rachel, you're going to be up first with the case study portion. All right. Rachel, you want to kick us off with the first case study?
Great. All right, so my name is Rachel, and I'm the founder and CEO of Better. And the reason I founded Better is because I have lost an incredible amount of money to insurance companies because I didn't have the time to go through their process. So the first thing that we did when we were designing Better is we looked at what is the least amount of information that we can request from a person to get them money back successfully. So what we're looking at here, this is a standardized claim form that your healthcare provider gets to fill out. This doesn't usually go well. They're quite confusing forms. And most healthcare providers, especially if they don't take insurance, they've never been trained on billing and coding. So you've heard ICD-10 mentioned. That's our current diagnosis coding system. We still get ICD-9, and that was deprecated a really long time ago. So not only do you need one of these to be filled out correctly to successfully get your money back, but you also have to fill out a multi-page form from your insurance company. So we can move to the next slide. So we've made this incredibly simple. We ask for name, address, phone number, take a photo of your insurance card, and you are completely done. Then, as you get claims from your doctor, you can either take a photo or forward us an email, and we do all of the work from there. So we've taken something that was this horrendous process with lots and lots of questions that needed to be answered, faxing and mailing required, and we've made it as easy as something you can do in 30 seconds.
Do you want to talk about anything on here that you learned, or history, any other little bits and pieces?
Yeah, so we'll go through one of our design failure studies. And when we first released this product, we're like, okay, you get a claim, you take a photo, done. And we got a lot of emails from people saying, my claim is 3 pages. I want to be able to add more photos. And we went, okay, we can match it up on our side, but if you really want to do that, we will let you. And what we started getting in the beginning when we released this feature was glamour shots of claims. So people would take one piece of paper and they would take about 7 photos of different portions of it just to make sure that it was legible for us. Unfortunately, on our side, that made it an absolute nightmare to kind of figure out what was on one piece of paper.
Amazing. Thank you so much. Appreciate that. Anything else you want to talk about?
I think we're good.
Fantastic. Thanks, Rachel.
Yeah, we noticed that one of the biggest gaps in our experience from a behavior change perspective, thank you, was the ability to help people actually put habits into practice. So we're pretty good at educating people. We could use some more tools within the system that help people try on a new habit and see if it fits for them. And so I think it actually started in a hack day. We hacked together this idea of challenges, which are basically habits that we use technology to help people build habits around. And so this is kind of the first proof of concept. And basically what would happen is a user would log in, they would see that there's an option to do a challenge from their kind of daily action list. We would kind of briefly introduce the concept of a challenge to them. We would then explain or give them the optionality to choose one of, in this case, 3 nutrition-related challenges, since that's what they're learning this week. We take a second to educate them on what this challenge, in this case, eating breakfast every day for a week, looks like. We celebrate their willingness to take on that challenge and try something new. And then we give them the ability to kind of monitor how they're doing throughout the week. And we're automatically giving them credit every time they track breakfast, or in the other case, eat vegetables, or decrease caloric beverages. At the end of the week, we celebrate, hopefully if they successfully accomplish the challenge, and give them a chance to reflect. And the coach is involved, the kind of watching throughout this and giving them support and positive reinforcement to make sure that, you know, this is something that's working for them, or if it's not, what might not be working.
Awesome. Can you talk, so what worked well about this, and anything that maybe didn't work well?
Yeah, I mean, I think people in the program are really hungry to try new things, and education is one thing, tools and techniques to help them actually put them into practice or compete or have a measurement to that is kind of an added bonus. And so this is something that we prototyped, launched in limited release, and something like 60% of people opted in and 50% completed. So kind of saw a lot of success, and as you're building things iteratively, this is like, all right, cool, if we think there's something here, let's keep going.
Anything that didn't work that you tried that?
So yeah, as part of the process of kind of fleshing this out, we tried applying this to other habits, ones that we wanted participants to do. So it's really important for us that participants weigh in regularly. We send them a 3G scale at the beginning of the program, and the only way we know how they're doing is if they step on the scale. And so we created a challenge to see if we could help them weigh in regularly. And I think, you know, there was much lower engagement rate and success rate when you're trying to get someone to do something that you want them to do rather than feels organically important and interesting to them. And so we removed that from the product.
Excellent. Thank you so much. Appreciate that.
So this is the opposite of what Better does.
This product is called Worst.
It's it highlights again the importance of context and why you're designing what you're designing. So we talked a lot about collecting data. For us, we have a home visit program where we'll send a nurse to someone's home in New Jersey to do a comprehensive health assessment. So this form is basically an expert system to be able to collect as much data as we possibly can, because that data helps power, for one, a better understanding of what that member's conditions are, so that we know what we need to be on the lookout for and how to coordinate with other people in the care system. And then on the other side, more data actually helps us with our revenue. So it's a double whammy, like we need all the data we can get. So this is a gigantic form that basically has 18 master sections. The success of this was because the business knew that, so I'll rewind. 3 years ago, our nurses were using paper, and they were carrying stacks of paper around New Jersey to people's houses. That gets heavy at the end of the day, or probably even at the beginning of the day. And then when you have PHI in your car and you're in a bad neighborhood, and if your car gets broken into and that person's information gets stolen, that's bad. And then they were also having to take that paper and then at the end of the day transcribe that back into some other digital system, which creates the opportunity for data entry errors. There's tons of data entry in healthcare. So we had a designer go out to New Jersey and visit with nurses in the field and see what it was like to be them and go around to different people's homes. And then created an iPad app. It's all web-based. We use local storage in the browser to create one stack. And then over the years, we've iterated on it to the point where this is a really successful product that both helps us understand our members really, really well. They all rave about this because their doctors often only spend 8 or 7 minutes with them at a time, whereas this is a really comprehensive health assessment. And then we can also take things that we learned during this and refer them to things like social work. Or sometimes we'll visit a member's home and we're like, you need to go to the hospital right now. The thing that's open that you can't really say right now is like a smoking, asking them if they smoke and would they like to stop. One thing that we also learned was that people don't talk about their health linearly, so some good form practices are make it, if it's really long, do it stepwise. We can't do that because if you're talking to somebody about smoking and you ask them if they want to stop, they're like, yeah, well, I thought about stopping, but I'm depressed a lot, so smoking a cigarette every now and then actually makes me feel better. You've got to jump down somewhere else and talk about like their depression and enter that really quickly so that it's in the moment. So we had to create something that let them jump around a lot and then also add things as they came up. So we would try to preload what we think they're going to have to talk about, but then allow them to add in there. So it's sort of like a choose your own adventure, gigantic health form.
And I think this is a great example too of like a lot of the times in healthcare you're replacing pen and paper. So even like a really effective dynamic form can be a huge step change to what exists. You want to talk through this thing?
This was a failure case. A lot of best practices tell you pick an audience, learn about them, go really deep into their world, and deliver a solution for them. In this case, we did that, and it turned out that that wasn't the most effective thing we could do for the company. So this is a screenshot of our provider profile. So in retrospect, we didn't do enough to learn about the full context. There are lots of people inside of an insurance company talking to lots of people inside of a doctor's office. And that creates data entry errors that we were trying to fix. But it turns out what you need is like a separate CRM and then a separate data quality management system, because data quality management doesn't just stop with provider data. It relates to all kinds of input that you get in the healthcare system. So when people are filling out claim forms manually and that gets entered, there are errors there. If you're ingesting, there are lots of service providers that do data of different types. If you're ingesting their data, it doesn't always match up with data you get from some other source. So merging those, using ontologies to keep track of what data means what from which entity and how you create a single view of that helps turn that data into some sort of insight that can be actionable. That's a bigger problem that we're now working on solving. So this, we went like off in one direction when we should have been going two other separate directions.
Excellent. Thank you so much for sharing that.
So just to come back to sort of, before we dive into the actual product, this is Bob Wachter. If you want to read a good book on digital healthcare, The Digital Doctor is a 4-hour read he wrote. He's also the chair of internal medicine at UCSF. This is him walking down the stairs with what they call a cow. It's a computer on wheels. This is 2018, the best mobile experience that UCSF, right? Not some random hospital in the middle of America. This is healthcare. So anyway, I thought I'd start with that. So we're in the business of trying to get lots of people to build for healthcare. We provide a platform where others can build applications, but we also wanted to sort of show that building applications for inpatient care is not sort of insurmountably difficult. So we sort of tackled this idea, is there a way to take the care team and give them something that would allow them to operate better as a team? And it turns out that if you spend some time shadowing doctors, they all have their sort of pockets, front pockets, side pockets, a one-page piece of paper folded up that they scribble notes on. So the average attending physician will see about 6 patients on a ward. There's like 5 more attending physicians consulting physicians. At the end of the day, they'll take out their piece of paper and they'll start like trying to decipher their notes of which medicines they prescribed when, to whom, for what reason, and then they'll sort of try to enter that into the system. So that's a single player mode, right? If you are one of the other consulting physicians, you are basically left guessing as to what your colleague basically deems to put in his notes at 11 p.m. And if you sort of have dependencies, that carries over into the next day. So the grand solution that hospitals have come up with, let's use a whiteboard. Because we can put it on a wall, like we can all sort of collaborate, and this sort of is the method by which teams now share information. So we look at this as like, well, there's probably better solutions to do that. Turns out that both paper and whiteboards are actually very hard to compete with. They are simple, they work, they know where they are, they know how to write, you can make corrections. But this was sort of one of the problems we took on. So if you skip ahead, it's a bit small, I apologize, but you'll see a few things. This is basically a digital whiteboard. It works on a cell phone, and it works on a desktop. Windows, it's a good example of like, designing for healthcare. And it turns out that what we needed to do here was actually not reinvent the wheel. We just had to give them a digital whiteboard, literally inclusive of, hey, you can move columns around, you can rename the columns, it has the format for the demographics that they use on their whiteboard. And this was a mega hit. So 160 hospitals discovered this on their own. It's seen 500,000 patients. This was sort of a demo app, right, to show that you can basically compete with paper and a whiteboard. Things that sort of worked well here from a design perspective was just to stick to the basics and look at what they are doing in real life, give them a tool, and only take 2 or 3 things that you can do better because it's digital. So here, one of the things was, hey, you can take this on the go, right? So you're no longer tethered to a whiteboard. So when you sit down and write your notes at home, you don't actually have to stay in the office to be able to read off the whiteboard. You can do this when you're sitting sort of with your kids. That's a whole separate problem, but at least that was an improvement. If you look at sort of the next version of this, we're like, okay, so that basically worked. Now, what can you do? And it turns out that doctors are in many ways power users, right? We're used to thinking sort of financial traders. You give them Excel, they go build their macros, and they solve their own problems. Doctors are very much like this, right? These are people that want to solve their own problems. So it turns out that now that we understood what the basic product was, we could give them advanced filtering. And it turns out that they were very sort of happy users of this. There was this idea that one patient can exist in multiple teams, so we rolled out a multiple team version. We also encountered some of our first design failures here, in the sense that multiple teams was great as sort of a new concept that we introduced to new users. It was a terrible concept for our existing users, where we rolled out sort of multiple teams, and they go, right, like the data was migrated, but now I have this concept of a second team. I don't understand this functionality. I didn't discover this on my own. I don't know how to sort of train up on this. So we actually had to sort of go back and rethink how we do this for our existing teams. The other thing here that you'll see is this information density, right? There is nothing more popular in design right now than lots of white space. And from a consumer perspective, this is great. Doctors are like, I need to cram more data in here, so please, like, just smaller fonts. Like, I need more. Very counterintuitive. So our product managers in the company are actually doctors with a CS degree, because the only people that call BS on our sort of instincts are doctors who go like, no, you don't understand. I need to have more data. So really getting into the mode of, if you're designing for healthcare, start with what works for them, give them the digital equivalent, don't sort of go fancy, start with the basics, and then make sure that you're working with doctors who are telling you whether it works or not for them.
Amazing. Thank you so much, Janine.
So how many of you trust your health insurance company? Anybody? Oh, there's a... did you have Collective Health? No, just kidding. Not kidding. No, so Collective Health is basically an alternative to traditional health insurance. And one of our challenges is actually having people trust us. When I started, I was actually employee number 7. And when you think about it, it's like, okay, well, there's not a product yet, so what do we build? And what we build is an MVP. But what is an MVP for health insurance? That's not a thing, actually, as it turns out. Instead, we focused on what I call a MAS, M-A-S, minimally awesome service. So looking at a person's experience, so their health journey, and figuring out, okay, what are the big pain points and how do you make that awesome? And in the healthcare space, what makes something awesome is actually quite different depending on what touch point. So this is an example of one of our first iterations of what you get when you get your health insurance card. You will notice that there's gold embossing and a blind emboss. I'm a graphic designer by training.
But all healthcare companies do the golden boss thing.
They copied us, oh my God. No, but one of the things we're thinking about is, okay, well, no one trusts their health insurance company. So when you get your cards in the mail, how do we make this kind of an unboxing consumer experience? Throw some gold embossing at it. And I'm like a nerd for paper, right? So we're like looking at paper samples and I'm like, okay, well, this is the right weight. But it really makes a difference, right? To have that kind of physical touch and have something celebrate in your experience. But you start looking across the rest of the journey, and there's actually other things that make it awesome. So you can click. One of the biggest pain points we heard is, how do I even pick a plan, right? I don't know how many people have gotten something that's called an SPD, but it's a big explainer thing, and it's like, I don't understand what the PPO 500. So we wanted to kind of unpack that for people and make it very clear for the people that, 80% of people just need to understand, okay, well, what's the monthly cost? What's the implications? And if they're like out of network coverage. And then how does it compare? So like, this is a lower average cost for care. This might be higher, but you get more access because it includes out of network. And then giving people kind of a way to dive deeper. And so what makes this awesome is kind of translating all the healthcare garbly book and make it understandable and make that information hierarchy make sense. Another time that kind of we're thinking about what makes something awesome is, what if something doesn't go right? What if you get sick? What if you have a question and you call, right? So I don't know about you, but I'm not going to say which health insurance I have, but I've been on the phone for over an hour, right? And it's utterly irritating, and I probably have to call back. And it's not because that person doesn't want to help me, right? It's not because they just hire a bunch of jerks. It's probably because the tools that they have actually stink. So one thing that we did is actually focus on the tools that the people answering the phone, which we call member advocates, use. So this is an example of, I think, our first version that we did, which is giving people that answer the phone. So unless you actually are really steeped in healthcare, you might not understand all of this. But it's basically giving them the information that they need at their fingertips. So understanding, for instance, what their healthcare conditions are. Understanding, for instance, sometimes we get people that are a little bit more agitated or that have had a certain person answer the phone, so we try to connect them. And usually they're calling about the most recent claim that they had. So why not surface that right in center, right? And so that's an example of kind of the things behind the scenes that make something awesome and using design in that manner. And it's kind of interesting. We talked about kind of, well, what are the outcomes of that? So by focusing on member experience, what we've done is actually gotten an NPS. So those of you that know NPS, it's a Net Promoter Score, pretty standard in the industry to rate how the experience is. Our Net Promoter Score is 70. Other health, just to give you a sense, other health insurance, the good ones, are in the single digits, around 5. So we have a consumer experience for our members in an industry that isn't known for that. So thank you.
Thank you so much. Fantastic. Well, there's your guys' case studies. Thank you to all the panelists for opening up a little bit of their process and insights and also failure states. I think it's really important that as designers, as a community, we share not only all the things that are working out, but all the things that are failing as well. So we're gonna all gather. We're gonna give you guys time to mingle now. I wanna thank our panelists for taking all the time to put all that stuff together and sharing your insights. Give them a big round of applause. Thank you to Kelsey from our team and the Omada team for helping put all this together. Thank you to Picnic for all the wonderful and tasty food. Our panelists are going to be sticking around, so if you're a designer and you're actually starting to wonder, maybe I should be doing this healthcare thing, and you want to talk to some of these panelists about their companies, they're going to be sticking around. Please feel free to do that. Designer Fund team, Enrique, Dave, and Elena, could you raise your hands real quick? Enrique, hand up. So if you want to talk to Designer Fund about anything that we're doing or how we work with you or how we could collaborate, myself, Dave, Elena, Enrique are the people to talk to. So finally, healthcare today filled with a ton of opportunities, right? We looked at how we can improve healthcare. We looked at how we can improve the paying experience, how we can use data to get better outcomes, and how we help people make better decisions about their care. There's simply no shortage of opportunities for us when it comes to taking design and improving the state of healthcare. So we hope you all leave here today inspired, better equipped to help millions of people improve their lives. Thank you so much for coming. We're going to be around. Give yourselves a round of applause. Fantastic.